Hi, and welcome back to Shannon's Corner. I am Shannon Devereaux Sanford, and thank you so much for joining us here today. And we got lots of information for you, so don't go anywhere. We are going to talk about your skin. And that's a big, for women, that's a big topic. But men, you know, it's a bit of a topic for you, too. You remember, already he's forgotten. Already I'm trying to remember.
Clearasil.
No, not Clearasil. I'm trying to remember, now, isn't that silly? Who just ran against Obama with the okay.
Senator McCain?
Senator McCain. Okay, I just right out of my head. All I can think is Obama after yesterday. Mm-hmm. But do you remember his trouble on his face, that he got a few cancers out? We're going to talk about that. So if men don't think that they have skin problems, there's things to be...
But I think that's in a different category than acne.
It is. It's in a different category than acne, but still, it's something we have to be concerned about and think about. And I am going to ask Dr. Halem about this. And Dr. Halem is going to join me, and she is part of the dermatology team at Columbia East Side. And hi, Dr. Halem.
Hi, good afternoon, Shannon.
Well, good afternoon to you, and welcome to Shannon's Corner.
Great.
Nice to finally talk to you.
You too.
You know, this is winter, and as you know, this is the time of year, I'm sure I'm not the only one, that gets very dry skin. And for me, I get patches of dry skin, which I know is hot showers and things like that. And it seems to go in the summer. So, question, what do we do about things like that? And is it very typical?
It is typical, and people don't realize that during the wintertime, we lose a lot of moisture to the air, and this can cause cracking and chapping and irritation. And according to the American Society of Dermatologic Surgery, the sun can be just as damaging to the skin in the winter as it is during the summer.
Oh.
We often don't realize that.
No.
So there's certain do's and don'ts that I usually educate my patients on, and one of the biggest things is people need to moisturize during the winter time especially. And what I like to tell people to do is they take a pretty short, not so hot shower, and when they get out, they pat themselves dry, and when they still have the moisture on the skin, you apply the cream. And this actually seals in the moisture as opposed to applying the cream to dry skin.
Right.
So that really helps.
That does really help. I have done that for years, and that makes an enormous difference.
Right. And the other thing is to use a cream formulation, not a lotion. The cream actually is an oil-based formulation as opposed to the lotion, which is more water-based.
But most of us would not know that. How, you know, if you go into a store and you buy something, does it say cream and lotion, and are they exactly meaning what you're saying?
Right. It'll say cream versus lotion. So you want to look for the cream, especially during the wintertime.
Oh, okay. Okay, I never knew that. Okay, so if they are a cream, they will say it, and they will not put in there what the lotion puts in there.
Right. It's actually, you have more of an oil-based in a cream than you do a water-based in a lotion.
Okay. So.
But the other thing you want to do in the wintertime is don't forget your sunscreen. And this is really important. We think that the wintertime, it's not important to use sunscreen, but it's just as important, like I quoted before. And you want to use a sunscreen that's at least an SPF 30 or higher. And you want to find something that's a broad-spectrum UVA, UVB sunscreen.
And how about, I mean, you know, we hear now that we need vitamin D and that we should get a little bit of sun. So that seems to contradict that we want, even in the winter, a little bit of sun.
It's a very good point, and actually the Academy of Dermatology has looked at this, and you get enough vitamin D just from what you eat in your diet, and enough sunlight from just walking from your car, or, you know, to the house or walking around the city. You get plenty of vitamin D. You do not need to inadvertently sit in the sun to get vitamin D.
Okay, and of course, I guess that you know that where you get sun and sitting in the sun are two different things. You can get it, as you say, just walking. Sitting in the sun can hurt your skin.
Exactly.
So you can get it through your hands, your arms, things like that, right?
Right.
So
right.
You get it in other ways. Okay, so those are good things to do in the winter. And those patches of dry skin from the hot shower, I heard you, and I'm going to try to take your advice, not so hot shower.
Right.
But if you do, are there certain, like I know over-the-counter creams don't really help.
You can, well, again, the not-so-hot shower, you want to make sure that you moisturize those areas. Those are little dry areas of eczema. The other thing that I find is to use a milder soap. For example, there's soap out there that's for sensitive skin. I would probably switch over to something like that during the wintertime. That helps. And also in your detergent in your laundry, sometimes when your skin is dry, the fragrance in your detergent can sometimes cause you to erupt in these eczema patches. So I usually recommend switching over to a non-fragrance-free detergent and maybe getting rid of Downy or dryer sheets just for the winter.
Okay, well, that sounds fair. I like the way they smell, but okay.
I know. You got to give that up.
Yeah,
you know,
you do.
get nice skin.
That's true. Okay, what is the difference between eczema and psoriasis, or are they the same?
They're similar, but eczema is actually just some irritation of the skin. Psoriasis is an actual certain type of disease, and they look different, and most dermatologists can tell the difference, but they are two different disease entities. Sometimes they are treated the same, but just depending on how advanced you are, one versus the other, the treatments can alter.
And with children, now I know that when my daughter was very young, she had very bad skin rashes, eczema, psoriasis, whatever. She also had asthma. I never asked her pediatrician, but I've heard since then that they go hand in hand. Is that true?
It's very true, and it's very common in children. We'll see what we call atopic dermatitis, and that's exactly what eczema is. And usually these children have asthma or other types of allergies, and what atopic dermatitis is it's actually asthma in the skin. So it's the same it's the same pathophysiology of what's going on in the lungs is happening in the skin. It just manifests one as asthma and the other as a rash. So it's the same concept.
Can we use over-the-counter for that, or do we have to get something by prescription?
You can, just depending on the severity of it. So the one thing with my pediatric patients who have atopic dermatitis, again, the same thing. I have them moisturize with usually a fragrance-free moisturizer. I have them use a very mild soap in the shower or bath, short baths. When they get out, you moisturize. You can try some hydrocortisone, 1% over the counter. And if that doesn't help, then I would go and see your dermatologist.
Okay. All right. So, but do treat it, don't ignore it sort of thing, especially in kids and even in infants, I know.
Right. If you do ignore it, these kids tend to become secondarily infected. Oh. And then it just exacerbates the eczema.
Okay. And in grown-ups, do these things spread? I find in the winter that when I get dry skin, and as I said, I know it's probably from hot showers because I don't get it in the summer, and in the summer I don't take hot showers. But does it spread on people, and is it contagious at all?
It's not contagious. It can spread if your skin is dry.
Yeah, I find that.
I find that the skin is an interesting organ. If it's dry, it sort of erupts and becomes itchy, and then you'll scratch it and it becomes drier, and it's sort of a vicious cycle.
Right.
So the key is really moisturizing.
Moisturizing is always the key.
Yeah.
And what you said about doing it while your skin is still damp or wet is wonderful.
Right, that's the key. And also, you don't want to forget your hands, especially in the winter. You do want to pamper your hands. Wearing gloves is a great idea, but you also want to apply moisturizer, especially to the nails and the cuticle area as well.
Okay. All right. So that's all good for the winter. We need to use the sunscreen, as you said. How about acne? I know that's a big topic, and we're going to talk about that with kids and grown-ups. Does that have a seasonal time with it too as well?
I don't find it seasonal, but the one thing I do want to mention real quick back on winterizing your skin is don't forget your lips.
Oh, okay.
People forget their lips, and I see a lot of skin cancer on people's lips, so you do want to get a moisturizer that does have sunscreen for the lips.
You're saying that if it gets dry, you can get skin cancer, one leads to the other?
Well, no, but you want to use a moisturizer that does have sunscreen to protect you against the sun.
I see. Okay. And, okay, so that will protect you. So all of them, I guess most of the chapsticks really do. Some of them are so thick that I think just the thickness protects you, doesn't it?
No, the thickness definitely doesn't protect you. You need a ultraviolet barrier.
Oh, how about lipstick? Most
lipstick
women
does not protect you. It's a good question because I've been waiting for them to put out a lipstick that does have an SPF in there.
Oh, see, now I always thought since I wear lipstick that was protection
enough. No, it does not protect you.
Oh, okay.
No, so you do need to find something that does have a sunscreen in it.
Okay, so put it on first, like a moisturizer with a sunscreen before your makeup, that sort of thing, the same sort of thing. Exactly. Okay.
So as far as teenage acne, it is not seasonal. I usually don't see it seasonal. The reason why some teenagers get it and some don't, nobody really knows. Some people think it might have a genetic component, but nobody really knows that. So there's things you can do to prevent it. You want to make sure that you get on a good skincare regimen starting in your teenage years, washing your face daily, keeping it nice and clean. The one thing I do recommend to all my patients is not to pick at the lesions. I can get rid of your acne. I have a much harder time getting rid of the scarring.
I see. Okay.
So if you can keep your hands off of it and not pick, I'd rather you come see me, let me treat your acne, because once you scar, it's much harder for me to help you with that.
Okay, so no poking at the blackheads or whatever everybody thinks they should pop them. We've always heard that. Pop a blackhead, pop a whitehead. I mean,
no. Come in and let your dermatologist do it for you.
And what should you do in the meantime before you make that appointment? Rich and I were mentioning it, and I've heard this, that toothpaste works. To put a little dab of toothpaste on a pimple?
I have not heard that.
Oh,
okay. I've not heard that. I can't imagine why that would work except to just dry it out.
Dry it out,
probably
exactly.
Put some alcohol on there as well. But some of the over-the-counter treatments you can try first.
Okay.
Some of the ingredients you want to look for is benzoyl peroxide.
Uh-huh.
That's one of them. Salicylic acid. And there's a couple companies out there that do make some products like that. And you can try that at first. I usually find that prescription strength is a little bit better, works a little bit faster and quicker. So then you want to come in and see your dermatologist and get you on a good regimen.
Okay.
Which might include peels, topical medications, and may or may not include antibiotics.
Oh, okay. For teens especially, because they can be really a chronic problem. I mean, more so than just the occasional breakout for people in their 20s.
Right, exactly. It can be a chronic problem, and again, with the scarring, you want to minimize scarring.
Uh-huh.
That's the most important thing. So the longer they have it, the more likely they are to scar.
Okay.
And especially in African American skin, what happens is when they finally get cleared, they heal with a darker spot. And you want to prevent that. You can prevent that by preventing the acne in the first place.
Okay. All right, we're going to take a break. We're going to talk a little bit more about acne, and we're going to talk about some of the products you can use when we come back. We're talking with Dr. Monica Halem, dermatologist at Columbia Eastside, and we'll be back in just a few on WTBQ.
You're always treated to a great meal at the Copper Bottom restaurant in Florida. Lunch at the Copper Bottom features a great selection prepared to perfection. Come for a delicious dinner in their cozy atmosphere. The Copper Bottom starts your meal with prime Angus beef and the freshest seafood. Come see what the critics are raving about. Call 651-5700 for reservations or for information on having your next party or event at the Copper Bottom Restaurant. The Copper Bottom Restaurant, on the corner of Route 17A and 94 in Florida, New York.
Don't put off your college education because you think you lack time or money. Call the Academic Advising Center now. You'll benefit from assistance from academic advising professionals who will match you with the right colleges, the right academic programs that fit your lifestyle and schedule. From Ivy League to small schools, you'll get unbiased information. If you're 17 or older, call now and you'll be entered into our $10,000 scholarship program just for calling. Call 1-800-983-1632. That's 1-800-983-1632. Act today for a better tomorrow. 1-800-983-1632.
Teaching you to save more, spend less, and avoid getting ripped off. Clark Howard.
I quote him all the time when it comes to saving money.
He has taught me some things about putting money away for the future that I really enjoy.
Weekdays from 2 to 4, WTBQ.
If you missed the Frank Truett Show, here's what you missed.
I think we can put Uncle Buck inside the cage. Uncle Muck. We've run amok.
I got him stuttering in the other room. I love it.
We would like to inform our affiliates that we may be running over slightly.
I need another vacation.
The Frank Truett Show, weekday mornings till 9 on WTBQ.
WTBQ weather.
As we go through the afternoon, clouds will continue to increase and we'll find temperatures only going just above 20, and there may be some flurries developing during the evening. Now for tonight, the threat for flurries quickly ends and skies partially clear, lows again 10 to 15. After a cold morning on Thursday, it will be noticeably milder in the afternoon, highs 30 to 35 and a mixture of sunshine and clouds, and then partly to mostly sunny on Friday. From the WTBQ Weather Center, I'm meteorologist Sean Rowland.
WTBQ.
Hi, and welcome back to Shannon's Corner. I am Shannon Devereaux Sanford, and thank you so much for joining us here today on your favorite radio station, WTBQ. And we are talking about your skin today, which is actually very important, especially in the winter. You know, it's cold out there, and when you get out there and it's cold and it's windy, you get chapped skin, you get chapped lips, you get dried out, and boy, we start itching. Even my daughter said to me the other day, Mom, I'm so dry, I'm itchy. And you know, I think everybody kind of gets some of this. We are talking with Dr. Monica Halem. She's part of the dermatological team at Columbia Eastside in New York City, and she's giving us some good hints. And one of those is always wear sunscreen, chapstick, something to protect your lips that has sunscreen on it, not the hot showers. Those are all good things to do in the winter. Moisturize. Are there any products that we need? I mean, I have spent $100 on a cream and I have spent $5.
Right.
And sometimes I swear there's a difference, but ultimately I'm not sure there is. Is there?
Well, it depends on what you're talking about. Are we talking about creams for the face or creams for
Face.
the body?
Face.
The creams for the face. So I'm a big proponent on not needing to spend a lot of money for skincare.
Okay.
I think that there's plenty out there that we can do where you don't need to spend a lot of money. I think a lot of what companies out there say is hype, and there's really no science behind what they claim. So I've done my own personal investigation of all the different creams out there, and I really I've come down to some very simple product lines. The one thing every woman and man does need in their skincare regimen is a sunscreen in the morning.
Okay.
So what I like to do is I like to apply a basic moisturizer. I'll use something very soft to wash with, like a Cetaphil, and then I'll use a basic moisturizer, even a Cetaphil with some sunscreen, and then I'll go ahead and apply the sunscreen on top of that. And that's basically what you need for the morning.
Okay.
And then in the evening, again, I'll wash with a gentle cleanser. And I think every woman and man needs a retinoid or a Retin-A during their nightly routine. And this actually does a couple of things. One, it increases collagen production. It helps to normalize the epidermal barrier, or the skin barrier.
Mm-hmm.
It also is cancer preventing. And all of these sort of work together, and I think that should be part of every skincare regimen in the evening. And then that should just be followed by a heavier moisturizer. You do a lot of skin repair and renewal during the evening.
A heavier moisturizer.
It could be anything from Olay to Cetaphil, anything that you see at your drugstore that just is like a cream base.
Right. Nighttime sort of thing that it says.
Perfect.
Okay.
Right. You do not have to spend a whole lot of money to have nice skin.
The Retin-A and the retinol, I might be very different than everyone else, although I don't particularly have sensitive skin. I can't use that. It just does not work with me. I get very red and peely. And is that common?
It's very common, and the reason that happens is people don't know how to apply it.
Oh.
So I go through an intense instruction on how to apply this, and basically what you do is you apply a pea-size amount to your finger, and you touch your face in 4 places and you rub it in. It's a medicine, not a cream. So you don't, even though it's in a cream formulation, you don't put it on like a moisturizer.
Okay.
What happens is if you do that and you use too much, you get red, irritated,
Absolutely.
Inflamed, and then people say, oh, I can't handle it, and they
Right.
never use it again.
Exactly.
What's happening is you're just not applying it right. So a pea-size amount, touch in 4 places, rub it all over. You'll feel like you have nothing on your hands, but you do because it's a medicine.
Right, okay.
And what I like to do is I like to start every 3rd night, and I'll have my patients use that for a couple of weeks. Then I'll move to every other night, a couple of weeks, and then every night.
Oh, okay. So ease into it.
We're easing into it. You got
Okay.
it.
And are we talking about prescription, or is this over the counter?
You can start, before you start on a prescription, there's a company by the name of Rock that makes a retinol night cream.
Mm-hmm.
And you can start with that, and that's a good way to ease into it before you get up to prescription strength. But a retinol is the only product that's been studied, that's been scientifically shown to actually make a difference in skin.
Okay.
Everything else out there is just hype.
Okay, so get an over-the-counter Rock is ROC. I've seen it. I've never
ROC.
used it. Yeah. So you could get that, start it slow, and then go and get a stronger prescription strength.
Exactly.
Now, does that take the top layer of your skin off? Is it a
takes
slight
all
peel?
It takes all the dead layer off and actually gives you a really nice glow.
Okay.
The reason why our skin looks dull is because of the different surface areas of the dead cells. So if you can get rid of that and you have a nice clean skin, you'll sort of glisten.
Okay, so the peels that we can do at home and the scrubs and those dermabrasion things, or do they do the same thing?
I'm not a big fan of too much scrubbing. I think that you can injure your skin. So maybe once a month.
Oh, okay.
I would recommend a scrub. That's it.
Okay. Yeah, I've wondered that. You feel like you're sloughing your skin there, like your feet almost.
Right.
It seems a bit tough tough, but yet everybody kind of says to do it, and they're all over the place.
Right. No, I would recommend once a month. Your skin wants to be treated very gentle. If you
I
take
see.
care of your skin, it'll take care of you. And, a lot of times people with acne feel like they have to scrub very hard, and it actually makes it worse.
Okay. Yeah.
So I would recommend a scrub once a month. If you want to go to your dermatologist and get a peel once a month, that's great too. It does the same thing. It sort of helps get rid of those dead layers and help it, renew the skin.
Dermatologist, but not at-home peels necessarily.
I wouldn't recommend at-home peel.
I wouldn't either. I have burnt myself with them, and I'm sure I'm not alone. So,
yeah,
I think they're a little dangerous is really what it comes down to, unless you're very, very careful.
Right.
Okay.
I agree with you.
And the creams, is there a first ingredient we should look for?
Not really. No, you just want something that's moisturizing. It should have like a glycerin in it, or any heavy-based cream. Petrolatum is nice. Those are some ingredients you want to look for. I happen to like the Olay Regenerist.
Yeah.
Fine.
Everybody likes Olay. Even the light Olay.
Yeah.
Just the basic one for the day works well, too. It seems very light and not heavy. Because some of these things seem to clog up your skin, don't they? They feel like they clog up your pores.
They can, and you definitely want to look for something that's non-comedogenic.
What does that mean?
Meaning that it's not going to clog your pores. It'll say that on the product label.
Okay. All right. And what should we look for in moles? I often think about that. I'm getting to that age where I see a mole and it starts to itch and I worry, or it looks a little odd and I wonder if I should do something. Is there a rule of thumb on that?
There is, actually. The American Academy of Dermatology put out a sort of what we call the ABCDEs of melanoma. And what this is so you take a look at your moles, and I would recommend you do this once a month.
Oh, okay.
And maybe see a dermatologist once a year. But once a month, take a look at your moles and see if anything, and we go by A. So you see A stands for asymmetry. So you look and you see, and you divide the mole in half, and you see whether each side is symmetrical to the other. That's one thing you want to look for. B stands for border. And the border, you want to make sure that it's regular. If it's irregular, that could be something concerning.
Okay.
C is for color. You want to make sure that it's not a whole bunch of different colors, and it's not black, and it's not dark brown. So that's the C. So that's A, B, C. D is for diameter, something greater than 6 millimeters. Anything greater than a head of a pencil eraser, something to be concerned about. And E is for evolution. So anything that's changing, whether it's growing in size, it's changing in color, it's changing in texture, those are the basically the things you want to look for. And any of those signs, you want to come in and have your dermatologist just check it out.
And some of those can be serious, right? And some can obviously not. But
right.
Is that how cancer starts? I mean, we spoke about Senator McCain earlier and his face. Remember all that stuff? Is that how that kind of starts?
That is. Now, there's 3 types of basic skin cancer. And on the one hand, you have something called a basal cell carcinoma. And this looks like a little red pimple, and it is the least aggressive, doesn't go anywhere. You basically need surgery to take it out. And it's caused 100% from the sun.
I see. Okay.
That's the basal cell. The next one is squamous cell, which is a little bit more aggressive, can go to other places, and again caused by the sun. The third one is melanoma, which is what Senator McCain,
right?
Not Dr. McCain, Senator McCain had. And that's the most aggressive, and that's the one where you really want to look for in the ABCDEs that we talked about. And those could be a changing mole, a dark spot that's just growing irregular, and that's when you want to come in to see your dermatologist.
Okay, so take a look at those. Now, how about skin tags? I say that because I don't know if other women, but when I was pregnant, I got lots of them, and a dermatologist took them off. Are these common for women?
They're very common. They're common during pregnancy. They're common as we get older, and they usually happen around the neck, in the underarm, underneath the breast. So they're very common. They're nothing to worry about. You can have them removed, or you can leave them there if they're not a problem.
Okay, so they're nothing to worry about. If they're new, if they're hanging, everybody goes, oh, look at that, it's hanging. But that's kind of what they do, isn't it?
Right, that's exactly what they do, and they're nothing to worry about.
Okay, well, that's good to know, because you don't know whether they're moles and should worry or not. Another question I want to know, and every woman out there wants to know, how about collagen injections and Botox injections? Are these things safe?
They're extremely safe, and actually that's one of my specialties. So we've been doing Botox now since the early 80s, and in cosmetic uses, there's never been a problem with Botox, except that one incident when somebody ordered from a non-reputable place. So you do want to make sure that you go to a dermatologist or plastic surgeon who's going to be able to, do it appropriately. I would not go to a spa or, a place where it's not a qualified doctor who's injecting you.
Yeah,
that's the first thing.
So those spa parties at every, female's home sort of thing, at, a Desperate Housewives sort of, thing is not a good idea.
I am very much against that.
I'm sure.
Most
Okay.
of the problems I see come from those situations.
Yeah.
So Botox is very safe. It was actually originally used for patients with eye problems, and then they found that it actually decreased wrinkles. So it was found inadvertently to have a cosmetic effect. So I treat many of my patients with Botox. It's fantastic. I'm a big
okay.
fan.
All right. Okay. Because, you hear sometimes these horror stories, and are they just kind of made up, or people maybe overly do it? I mean, there's, people's faces who don't move very well. And
Right. I mean, you can overly do it.
Yeah.
And, you just have to go to somebody who can do it well for you.
How often do you have to have it done?
Usually around every 6 months.
Mm-hmm.
But what it does, so it actually relaxes the muscle. Now, you don't want to completely stop the muscle from moving because you still want to be expressive.
Right.
So what you do, it actually relaxes the muscle, and it prevents you. So not only does it treat the wrinkle, it prevents you from ever forming a wrinkle in that area.
Uh-huh.
So I usually it's good to start young, actually, in your 30s or 40s, and have it done, and you over time you won't really form wrinkles in those areas.
Oh, okay. So you just keep having it done, and it can actually prevent, then, I would think, having a facelift.
It can. I mean, there's certain indications for a facelift.
Right.
Botox can't
Right.
adjust to, but there's so many things that we can do now in dermatology that you don't have to go for that full facelift.
Uh-huh.
There's between the Botox that we have and all the different fillers that we do have now on the market and all the different lasers that we have, there's so many things that you can do to really, sort of rejuvenate your face before you ever have to move into a big facelift.
Okay, so get friendly with your dermatologist, right? Because no, it's true. Without your skin looking good, there's just no way as you age that you can look good.
Right, and it makes you feel good. I mean, when people come up to you and know your skin's beautiful, you just feel radiant.
Oh, absolutely. Oh, it makes all the difference. I mean, your confidence, your look, everything. And skin is, makeup is secondary, but if your skin is not good, it's just nothing looks good.
Right. I've heard many makeup artists say that. Good makeup starts with good skin.
Absolutely. Let me ask you another question that everyone talks about. Is it true that we need 8 glasses of water a day to look great? And does food matter, what we eat?
I think it definitely matters. I mean, drinking water obviously helps the cells. So that when you drink water, the cells in your skin and everywhere else absorb that water, and they become plumper, and your skin looks better.
Okay.
So that's definitely. And I think just healthy nutrition and less stress, which we could all use.
Right. Good sleep.
And
right.
more sleep does help.
Okay. So all those things are really true and important. And, take care of your skin. You only got one skin,
right. Exactly.
That's really important. Well, Dr. Halem, I thank you so much for joining us today. You were very enlightening. I thank you.
Thank you very much.
Thank you very much. Okay, everybody, we got to take a break. By the way, you can get Dr. Halem's information on shannonscorner.com. And when we come back, we're going to chat a little bit. So stay where you are, and we'll be back in just a few on TBQ.